Jackie, I understand I got another question.
Yeah.
Can't wait to hear my question. What's the question?
Jay, what's that question that the emailer just sent?
Mr. Answer Man, you see, I keep getting this infection that the doc at the hospital calls staph. But I ain't got no insurance. What can I do?
Jeff?
To answer that question with staph infection, real quick, one, clean your ass. Clean your house, clean your car. Well, if you have a car, clean your car, clean your toilet, clean your bed, burn your sheets, clean yourself and your environment around you. Don't use hypodermic needles. Don't share hypodermic needles. Do not, in any case, pick up a prostitute on Dundalk Avenue that looks like her legs falling off, gangrene, or any type of crazy yellowish, cornea inside of her eyes. Stay away from that. You won't get staph. But let me elaborate on that. Why don't people have health care? How can we afford health care in this country? How can we give people free health care? Well, I have the answer. Number one with health care, here's what can solve this problem. Number one, privately. GM, Ford, and Chrysler, a few years ago, combined were spending $14 billion a year on health insurance premiums in order to provide UAW workers and their families with health care. Had one of those bean counters stood up and said, if we just allocated $1 billion of our premiums and built a hospital, you could even have used UAW workers in order to build a hospital, which would cost about $300 million, another $100 million in order to equip the hospital. Then from there, you would have offered anyone that graduated from the top medical schools and nursing schools, doctors, free education. If you graduate, you meet our standards of what we're looking for in terms of doctors, we pay all your debt in terms of your student loans. Anyone, as a side shot, who's rich, poor, middle class, it doesn't matter. If you're smart enough to become a doctor or a nurse and graduate, the United States taxpayer would be glad to pay all of your educational needs. Anything whatsoever, as long as you become a doctor and help save the world. Let's go back to GM, Ford, and Chrysler. Had they made this package available to themselves, where they just took care of the UAW workers, let's say in a city like Detroit, high concentration of UAW workers. Once those workers started using their hospitals and their facilities, then from there, once the UAW or GM, Ford, or Chrysler got the hospital business pretty much wrapped up in one hospital, they could have spread it in different locations throughout the United States where the concentration of UAW workers exist. With that, once they were up and running and had a good reputation, GM, Ford, and Chrysler could have competed with Hopkins, Kaiser Permanente, or any other major carrier or provider of health insurance. They could have even done the procedures cheaper, so insurance companies would even encourage their policyholders to use UAW workers or UAW hospitals because they could do it cheaper than, let's say, Hopkins, Kaiser Permanente, or the rest of these franchisable hospitals that we now have. With that, once UAW established a hospital with GM, then from there, they wouldn't just have been a car company. They could have been a national provider of health insurance for everyone in the United States at a cheaper, better rate. And one of the easiest things to do to eliminate healthcare costs is to eliminate the insurance companies. The health insurance companies are in it for profit. They are the middleman between the patient and the doctor. And by them being there, and the reason why they exist, and why they pay millions of dollars for lobbyists to make sure that they exist, and make sure they pass laws in order for little guys like me who own a business to somehow, if I could, afford health care to my employees, I'd love to give health care to my employees. I myself do not have health care even for myself. And again, they're going to lobby to make sure we're paying more premiums for the most minimal of coverage whatsoever. And that's a very important statement right there, that what coverage we can afford won't cover our medical needs. Publicly, if the President Obama and the administration could look at the medical system as a whole rather than little compartments, they could solve the problem of giving free health care or very affordable health care to everyone. Medicare and Medicaid exists now in the government, which provides millions of people Medicare and Medicaid assistance once they reach a certain age, or if they're on SSI, or whatever factors they have that you qualify for health care through the government. It's a very efficiently run system, believe it or not. There's a lot of fraud by doctors who are making fraudulent claims, and these people are usually caught and prosecuted by the government, which they should be. If Americans could take the healthcare industry, the for-profits, the Blue Cross Blue Shields, Aetnas, and all those out of the equation and pay our premiums directly to the U.S. government under the Medicare and Medicaid plan, almost everyone in this nation would be covered. I would rather give my premiums to the government in this situation because the money would be used for medical care. Because they don't have a huge staff, they don't have commissions, they don't have salesmen out there, they're not, but I'm not saying the government couldn't be corrupt in the system, but what I'm saying is that if the government wants it, then let's pay the government our premiums, not the healthcare industry. That would be the public way to handle the healthcare crisis. Stop listening to all your economists from Stanford, Harvard, and Yale who are proposing these crazy ideas of how to give health care or make it affordable. They're just going to make it worse. Give people free health care by giving doctors free education, nurses free education, and having the U.S. citizen opt into paying Medicare and Medicaid, paying our premiums directly to them rather than the for-profit organizations out there. That would take a huge burden off the American people of having health care. And remember, even with your health care coverage you have now, no matter what program you have, they're only going to pay 80%. And if you make $100,000 a year and you come down with cancer, that 20% gap is enough to bankrupt 90% of our population. So our system that is in effect right now does not work even if you have coverage.